Hello, friends. I'm Tanya Griffith, the Director of HR, and I wanted to take some time to discuss one of the more complicated decisions you'll make during enrollment, which is choosing between the PPO and the high deductible health plan. Before we get to the differences between the two plans, let's first be clear about a few insurance terms that we'll talk about. The first one is the deductible. The deductible is the set dollar amount that you pay before insurance coverage begins. So essentially, you're paying every dollar of every bill up to the deductible amount. And then after that deductible is met, you move into co-insurance. Both of our plans offer an 80/20. What that means is that the insurance company will pick up 80% of the bill after the deductible, and you're only responsible for the co-insurance of that of 20% after the deductible is met. The PPO plan does have what's called copays. So copays are the flat dollar amount that you're going to spend for a particular service. So like for a doctor's visit, that could be $30. For an emergency room visit, that could be $300, but it's a set dollar amount. That dollar amount does not go towards your deductible on those copays. However, they do calculate into your out of pocket. Your out of pocket maximum is the most that you would pay for health insurance over the course of a calendar year. It may be necessary to go back and review those definitions as you evaluate both plans. So we'll go ahead and talk about the differences between the two plans. Starting with the PPO does have a higher premium cost. So out of your every paycheck, there's a higher premium cost. There's also a lower deductible at $2,500. And the PPO works off of copay. So for every doctor's visit, emergency room visit, prescriptions that you get, the prescription copays can range anywhere between $10 or $70 using those copays. With the high deductible health plan, it has a lower premium per pay period, but a higher deductible. It's actually $1,000 higher at $3,500. So with a high deductible health plan, you're going to pay out of pocket for doctor visit, emergency room visits. There's no copays, but all the dollars that you spend, that amount goes towards your deductible. The same with prescriptions. There are no copays. You pay every dollar of those prescription costs up to your deductible amount. Um, so to kind of put this in context, let's talk about an office visit that you may have. Let's say it's the beginning of the calendar year, you haven't started your deductible, you haven't started your co-insurance, and you visit the doctor and you're being evaluated for strep. So if I'm a PPO user, I'm going to go to the doctor's office. I'm going to pay $30 for that office visit. Once I walk in the door to that office visit, everything else they're going to charge me for. So if they do a diagnostic test for strep, if they treat me for strep, all of that is going to be a charge toward my deductible. Okay. So then if I have the high deductible health plan, I'm going to have to pay the full price of that office visit. So I'm going to pay, let's say, $120, $130 to get to start my office visit. Once I get behind the door, the plan works the same. I'm still going to pay the full cost of the diagnostic test if I'm getting tested for strep, and I'm going to pay the full cost of any treatment that they have because I haven't met my deductible under either plan. So really the difference that you're talking about is what is that office cost at the beginning of the visit, okay? Now, in order to help with the cost of those high deductible health plans, the company does add money into what's called a health savings account. A health savings account, or an HSA as it's referred to, is a savings account that accompanies the high deductible health plan. So money in the account can be used tax-free when paying for qualified medical expenses. Those expenses don't necessarily have to be things that fall under your medical plan. They can be things for dental coverage, for vision coverage, anything that falls into that qualified medical expenses category. So for employees on the company's high deductible health plan, the company adds $25 per pay period into this savings account on your behalf. So that isn't money that you have to add, the company adds that into that savings account. And then you use that money to pay your medical expenses. When that money goes into the account, that money belongs to you, regardless of if you are employed or not. It doesn't belong to the company. It doesn't belong to the insurance company. It belongs to you. That money can also roll over year to year, and it doesn't need to be spent in the current year like the flexible spending account funds do. So you can continue to build that for a time when maybe one year you do have a little bit higher medical expenses than normal. You have this bank of money that you're able to use for your medical expenses. Okay, now that we've had a chance to talk about the differences and the details between each of the plans, let's talk about the math. So the high deductible health plan per pay period costs $63.90. However, the company is also contributing $25 into that health savings account that is money for you to pay medical expenses either now or in the future. So the effective cost of the high deductible health plan premium comes out to $38.90. Conversely, the PPO plan, the premium cost for that per pay period is $85.96. Okay, so we calculate the difference between those two numbers. That comes out to a difference of $47.06 per pay period, which is $1,129.44 for the year. So it's important to calculate that premium cost because as we review the deductibles between the two plans, the amount saved in premiums that we just discussed more than covers the cost of the extra deductible, which is only $1,000 difference. What we see here is a breakout of the bills paid by participant for the current plan year. Notice the number and percentage of employees that had less than $1,000 in bills for this plan year. This data tells us that at least 63% of you would have been better off on the high deductible health plan. Currently, we have 20% participation in that plan. A review of last year's data shows at least 50% of you would have been better off on the high deductible health plan. A high deductible plan is a type of health insurance with higher deductibles but lower premiums. You'll pay less money each month but have more out-of-pocket medical expenses before insurance coverage begins. This is an ideal plan for someone who is relatively healthy with low insurance needs now but would like to save for future expenses. An ideal candidate for a high deductible health plan can also be someone near retirement because the money can be used to offset the costs of medical care after retirement. A PPO is a plan with lower deductibles but higher monthly premiums. You'll pay more money each month but have lower out-of-pocket costs for medical services. This plan is ideal for someone who has health problems, visits the doctor frequently, or takes a lot of medications. Additionally, consider any upcoming plans for birth of a child or surgeries that could increase your cost per year. Keep in mind you may change between the PPO and the high deductible health plan from year to year. You're not able to do this in the middle of the year, but every open enrollment will provide a new opportunity to enroll in a plan that meets your needs. If you have any further questions or would like some more information regarding the PPO or the high deductible health plan, feel free to reach out to either myself or our broker at the Bailey Group with the contact information provided. Thanks so much.